Treatment #2 routine colonoscopies. We're told screenings save lives, but for colonoscopies, there's a hidden expiration date. If you're over 75, the rules of the game change drastically. The prevention suddenly becomes riskier than the disease itself. Why? Because the procedure is brutal on an older body. The intense prep alone can dehydrate you to the point of kidney failure or heart issues. Then there's the scope itself. The risk of tearing the colon wall skyrockets as tissues thin with age. And here's the kicker. Colon cancer is slow. Finding a tiny polyp in your 80s likely won't affect your lifespan, but the surgery to remove it could ruin your quality of life. It's a gamble where the house almost always wins. Unless you have a history of issues, ask your doctor if a simple stool test is enough. Don't let a calendar dictate invasive surgeries that your body might not be able to handle. Treatment #3 statins. Statins are the golden child of heart medicine, prescribed to millions to lower cholesterol. But for healthy people over 75, this prevention might be stealing your independence. The hidden cost is muscle destruction. A shocking number of seniors develop weakness and pain, making it hard to walk or simply get out of a chair. In your 70s, muscle is your lifeline. Losing it is the first step toward a nursing home, and it gets murkier. Statins are linked to increased insulin resistance, potentially pushing you into diabetes. There are even reports of brain fog and memory slips that vanish once the drug is stopped. Is it dementia, or is it the pill? If you've never had a heart attack, demand the hard numbers from your doctor. Don't trade your ability to move and think for a slightly lower cholesterol score without a fight. Treatment #4 proton pump inhibitors, PPI. If you suffer from heartburn, you've likely taken proton pump inhibitors like omeprazole or Nexium. These drugs are meant for short-term use, typically 2 to 8 weeks, yet millions of people over 50 take them daily for years. This long-term acid suppression creates a systemic nutritional crisis. Without enough acid, your body can't absorb critical nutrients like calcium, magnesium, or vitamin B12. You effectively starve yourself while eating a full meal. The fallout is terrifying. Brittle bones that snap easily and a significantly higher risk of hip fractures. But the real horror story is in the brain. Studies link long-term use to a higher risk of dementia. By messing with your gut and starving your brain of nutrients, these pills might be slowly erasing your memories. If you have been on these for years, do not stop cold turkey, as this causes rebound acid hypersecretion. Work with a doctor to taper off slowly while using lifestyle changes to manage reflux. Treatment #5 blood pressure medication. High blood pressure is dangerous, but treating it too aggressively in your later years is a trap. As we age, our arteries stiffen, and we actually need a bit more pressure to push blood up to the brain. When doctors chase perfect numbers like 120/80, they risk causing orthostatic hypotension, a sudden, dizzying drop in pressure when you stand up. That momentary spin isn't just annoying, it's a leading cause of catastrophic falls. One slip can mean a broken hip, a brain bleed, and the end of independent living. Studies show that older adults on intensive blood pressure meds are nearly 40% more likely to suffer severe fall injuries. If you feel lightheaded getting out of bed, your protection might be poisoning you. Monitor your pressure at home and tell your doctor you want stability, not just a pretty number on a chart. Treatment #6 hormone replacement therapy. Hormone replacement therapy can be a miracle for menopause, but how you take it matters a lot. Swallowing estrogen pills after 50 is playing Russian roulette with your blood vessels. Because the pill has to pass through your liver, it triggers the production of clotting factors. This creates a dangerous spike in the risk of blood clots, strokes, and pulmonary embolisms. The Women's Health Initiative study terrified a generation for a reason, but we now know the culprit was largely the oral delivery method. The suspense lies in the timing. Starting hormones too late, after age 60, can actually harm your arteries instead of helping them. If you need relief, don't swallow the risk. Demand patches or gels. They bypass the liver and are much safer. Don't let a desire for symptom relief turn into a cardiovascular emergency. Treatment #7 antidepressants, RI. Depression and anxiety are serious issues, but treating them with antidepressants like Zoloft or Prozac in older adults comes with concealed physical risks. These drugs mess with your sodium levels, a condition called hyponatremia. It sounds technical, but the result is terrifying: sudden confusion, seizures, and even comas, simply because your aging body can't balance fluids like it used to. And there's a physical toll, too. These pills aren't just working on your mood, they can make you dizzy and prone to falls, doubling your risk of a fracture. They also thin your blood, making internal bleeding much more likely if you take aspirin. It's a chemical minefield. Before you commit to a daily pill that could land you in the ER, explore safer options like talk therapy or lifestyle changes. Treat the mind, but don't sacrifice the body to do it. Treatment #8, sleeping pills, benzodiazepines, and Z-drug. Insomnia is torture, but the chemical cure is often worse than the disease. Prescription sleeping pills, including benzodiazepines like Xanax or Valium and Z-drugs like Ambien, are notoriously dangerous for the aging brain. The American Geriatric Society explicitly lists them on the Beers criteria of medications older adults should avoid. Why? Because they effectively switch off the neural pathways required for balance and memory. Using these drugs regularly is linked to a higher chance of developing Alzheimer's because they stop your brain from cleaning itself at night. You might be unconscious, but you aren't resting. You are accelerating your own decline. Don't trade a night of sleep for your memories. Look into CBT for insomnia or magnesium instead. Get off the chemical crutch before it breaks you. Treatment #9 antibiotics for UTIs we end with a shocking risk hiding in a common prescription: antibiotics for urinary tract infections. If your doctor prescribes Cipro or Levaquin, proceed with extreme caution. These drugs, known as fluoroquinolones, carry black box warnings for a reason. For older adults, they are notorious for snapping tendons, literally causing your Achilles to rupture just from walking. But the horror doesn't stop there. They can cause aortic aneurysm and severe mental breaks, including sudden delirium and confusion. Imagine being treated for a simple infection and ending up with a misdiagnosis of dementia or psychosis because of the drug's side effects. It's a terrifying case of the cure being deadlier than the cause. Unless it's a life or death situation with no other options, refuse these drugs. Ask for a safer alternative and keep your tendons and your sanity intact. Look, aging is not a disease that needs to be cured. It's a life stage that needs to be managed with wisdom. The healthcare system is designed to save lives, but it is also a business designed to dispense treatments. Don't let the fear of what might happen drive you into treatments that guarantee what will happen. Your quality of life, your ability to walk, think, and live independently is worth fighting for. Stay curious, stay skeptical, and stay strong. Thanks for watching. Make sure to like, subscribe, and hit the bell for more health-related truths.